I'm Ian Howard, the Director of Integration here at Conscious Health in Larchmont. And today I just wanted to take a moment to answer some frequently asked questions that people have when they come in for our ketamine treatments, and in particular, what the experience is like for the ketamine treatments and also for the integration sessions that we have after those ketamine sessions. So the first question is therapy for ketamine the same as the other times I went to therapy in my life? And will I have to do things like recount my childhood traumas, talk about my difficulties with my mother and my father? This is a great question. And the answer is no. The ketamine therapy, or what we call integration therapy here at Conscious Health, is unique in that we use an insight-based therapy and some other modalities to really just explore this ketamine sessions that you have here at Conscious Health. Now, they may bring up some of these issues that you've had in the past, but we'll be looking at it through the lens of this particular type of integration therapy, and also with the new insights that you're getting from these ketamine treatments here at Conscious Health. The next question is, what is integration and why is it important when doing ketamine? Well, we found here at Conscious Health that ketamine experience brings about a lot of new insights, a lot of new things that you see, a lot of things that you begin to understand, and that requires what we call integration therapy to assist you in understanding these new insights, applying them to your life, and seeing how these manifest in new change and new ways of seeing the world and yourself. How often is integration therapy? So we found at Conscious Health and Wellness that it's most beneficial to have your integration session the day after your ketamine experience. And these are done most often via telehealth, via Zoom. So this allows you the convenience of being in your home or, on a break at work or these different times in your day that you have the opportunity to do this integration. And that way you also don't have to come into our clinic 2 days in a row. The next question is the integration therapist an actual therapist? The answer to that is yes. All of our integration therapists here are licensed therapists, whether master's level or PhD level. But yes, they're all actual therapists, and also they're all trained in the particular integration therapy that we do here at Conscious Health. Should I bring anything with me for my first ketamine session that will help with the integration? Another great question. And the answer to that is no. You don't have to bring really anything with you. We're going to supply all of the different things that you need here. We have a journal available for you. We also have an intention setting card. Now, that will be one of the things you will be bringing, right? An intention to be set for the session. But you're often exploring that and setting that during the session of integration that you do the week prior with your therapist. Now, this can change, so you may come up with a new intention, and by all means, you put that on the card, and but that's the only really thing you're bringing is some form of an intention to the session. But again, everything else, the journal or any other things that you need, we're going to supply here. How often should I journal during the session? Another great question. We do supply you with journals here for your ketamine treatment with us here at Conscious Health. And so the answer to that is it's up to you. We often feel like journaling after the session is really is really powerful. Yet, if you're feeling up to it, journaling and doing things during the session is also a great thing. I guess it just also depends on what you're feeling, and you want to just go with that. If you're feeling like just kind of being with the session and not writing a lot of things down, that's wonderful. But if you're feeling like you want to be more active in the session, so be it. So again, we recommend what you feel good about doing and what you feel capable of in the moment. Is it true that I'll hallucinate and see things that aren't there? Well, to be more specific, while you're on the ketamine, what you will experience is derealization and depersonalization. Now, this is not of the hallucinogenic property per se. Yet, you are going to get into a space where you are very free of a lot of the constriction that we often feel day to day. So you will feel, a little bit of disconnection from yourself, but that's part of the journey. How long do the effects last? Typically, the ketamine effects last about an hour to an hour and a half. But you're here for, over that time for about 2 to 2.5 hours. So while you're here, you get to have that experience. And often people report that, sometimes it can be that full hour, maybe 45 minutes, that you're really in the feeling, in the deep feeling of the ketamine. After that, you can feel, you may get a little bit dizzy and things like that, but we have our coordinators here to help you through any of those feelings. And those are often pretty easygoing and rare. Are there people there with me during the session? So typically the answer to that is no. You are in one of our ketamine rooms by yourself, and you are, experiencing the ketamine session the way you would like to. We do have our care coordinator come in at the 40-minute mark to take your blood pressure, but that's about the only time that you're going to see somebody during your session, and that's because of our medical protocols. Now, if you have the need for ketamine assisted therapy, we do that here at Conscious Health. But oftentimes people will choose to do this on their own, and kind of have their own personal experience guided by the integration and the ketamine therapist that you're working with. What should I do in between the sessions? Well, that often is decided by you and the integration therapist that you're working with. But I can tell you that most of the time, what you're doing is you're increasing your awareness, your realizations, your insights. You're often journaling. So there is a little bit of homework, but you're really free to explore the things that you're getting during the ketamine session and then integrating with your therapist post ketamine session. So there is really no strict curriculum, but we do have some guidelines that you will explore with your integration therapist between each session. Will I need to do ketamine and integration forever? How long does it take for people to start seeing a difference? So the first answer is no. We recommend a 3-month regimen of this where you're taking ketamine and having the integration sessions weekly. But that's only a 3-month um, regimen. So you're not having to do ketamine forever, nor the integration sessions forever, obviously. And when do you start seeing a difference? Typically for me, I see people almost having an immediate shift. I often tell people that ask me, what's the first session like for a lot of people? Well, when I see people in the first session, it really feels like they've already started to make some changes and already started to see some new things. So it really has almost this immediate effect of change. And these integration sessions really help to lock those in and make those even more livable. Anything else that you would recommend for integration? I think really for integration is just about coming with openness to these sessions. What's great is that, again, all of the clinicians who are doing integration with you, they have a protocol that they're following, right? The Conscious Health has procured, and they also have a lot of training. So they're going to be your guide. Right, they're going to be your guide through this journey. So you often don't have to worry too much about what to do next or worry about how to implement all this stuff into your life. That's really at the core of the integration work you're doing with your integration therapist at Conscious Health.